Dr. Peng Chun Mien, Chairman of St. Luke's Hospital, Associate Professor Tan Boon Yao, Chief Executive Officer, ladies and gentlemen, thank you for inviting me to join you today. We will be launching St. Luke's Hospital's new interactive film titled Always Mother, which commemorates the efforts and sacrifice of those caring for persons living with dementia. It is estimated that 1 in 10 people in Singapore aged 60 and above are living with dementia. With Singapore's increasing life expectancy and rapidly aging population, the number of persons living with dementia is expected to rise. In the Quality of Life of Caregivers study, recently published by the National Council of Social Service, we found that slightly under half of the caregivers surveyed were managing well, and the rest, or slightly more than half, showed signs that they were burdened or barely coping. It is important that we continue to raise awareness about dementia and provide more dementia-friendly services, among other measures. St. Luke's Hospital has done great work in supporting persons living with dementia and their caregivers. Together with the Agency for Integrated Care, they've set up a Community Intervention Team, or COMIT. Nurses, occupational therapists, care coordinators, and medical social workers work hand in hand to bring help out of hospitals and directly to persons with dementia at their homes. Even after patients are discharged from St. Luke's Hospital, medical social workers continue to work closely with social service officers and patients' families. One example is Albert, a caregiver to his mother with dementia. After his mother was discharged from St. Luke's Hospital, the medical social worker helped the family to apply for financial support schemes and to enroll Albert's mother in a mind-stimulating program. Albert has also joined the hospital's Dementia Caregiver Support Group, which equipped him with communication and care tips. Such social health integration efforts set the tone for the whole of society collaboration that's needed to create a system of care for persons living with dementia and their caregivers. At the same time, the work of agencies like St. Luke's Hospital should be complemented by greater understanding and support from society. Now, this is where films like Always Mother come in. The film allows people to walk in the shoes of caregivers and better understand what it is like to care for persons living with dementia. It is particularly poignant in this year of celebrating Singapore families. Just as our parents had to overcome many challenges to give us a good start in life, so we must continue to care for them as they enter their silver years. For some of us, this is a journey that's made much more challenging with dementia. But I'd like to reassure caregivers that there is support for all families, which include the Caregiver Support Action Plan, launched by the Ministry of Health and partners to strengthen support for senior caregiving. Initiatives include the Night Respite Pilot, which supports caregivers of seniors living with dementia who experience behavioral and sleep issues at night. In addition, the community outreach teams, or CREST teams, focus on identifying and supporting caregivers' needs and increasing public awareness of caregiving concerns. NCSS is also working with the People's Association and the Caregivers Alliance Limited to strengthen caregiver support in our local neighborhoods. Caregivers can also tap on networks such as the WIN Caregivers Network and Project 3i to learn skills and coping strategies from other caregivers. We understand that the caregiving journey can also take a toll on a family's finances. There are subsidies for community care services, financial support schemes, and disability grants that are available to support you. I urge caregivers to tap on the available support. You are not alone in this journey. Now, most of us have heard the saying that it takes a village to raise a child. Likewise, it takes a whole village to care for our seniors. We can each play our part to extend support to one another. So I encourage everyone tuning in today to give generously to St. Luke's Hospital so that they can continue to provide holistic care for and enrich more lives in the community, including those impacted by dementia. You can also share this film widely with family and friends. Thank you, and please enjoy the film.
How long do you run the store for?
50 years with my husband.
And what were you guys famous for?
Fish head curry, the best in the West.
Wensi, do you know where you are now?
Doctor, how is my mother?
Mr. Ong, your mother is fine. She just has a little bit of bruising and a slight abrasion on her head.
Oh, thank you, doctor.
However, there is something else I would like to share with you.
What is it?
Have you noticed any changes in your mother's behavior recently?
Not really. Why, doctor?
Madam Wensi has been staying with us for a few weeks now, and we noticed that her speech is sometimes incoherent, and there are inconsistencies in her thought processes as well, among other symptoms. We are concerned that she may have dementia.
Dementia? Isn't she here because of a fall?
Yes, I understand. However, it is important for us to find out the root cause behind her fall. And in some cases, people living with dementia have poor awareness of their surroundings as their memory recedes. Right now, we are still trying to confirm the diagnosis, so Madam Wensi will be hospitalized for a few more weeks in order for us to run some tests. I know it is hard to take in. Let our dementia care team take care of her for a few more weeks, and then we'll be better able to advise on what to do next.
Dementia care. Is that why you called earlier to move her to this ward?
Yes, she will receive the appropriate care by our dementia care team. Thereafter, we will need to discuss with you both on how to take care of Madam Wensi upon discharge. In her current condition, Madam Wensi will need closer supervision in order to ensure safety.
Adjust your pillow. Are you okay today? Oh, okay. I'll come later.
Ma, they need you to stay here for a while more.
Why? No need. I want to go home.
Ma, you have to stay. Anyway, it's just for a couple of days.
No, I want to go home.
Ma,
我要回家。
calm down.
Where's my bag? 我的 bag 呢 I have to go already.
Ma,
我要回家。
Ma,
I want to go home.
Ma.
我要回家了。
哎，Lucas，去洗澡。
Let him play first lah.
Are we going to talk about it? 我知道你不能接受这件事，可是刚才你已经看到了，妈的反应这么激烈。
It's just so sudden. If we really need someone to take care of her, let me do it.
You want to do it yourself?
Ma worked hard to take care of me. Now it's my time to look after her.
Dear, you are hardly around the house. 到头来是我一个人照顾她。要不然这样，我们请个帮佣好吗？ My friend Rachel did the same thing with her mother.
No. I feel like I'm pushing my responsibility away if I did that. I'm her son. Her only son. You would do the same with your parents, wouldn't you?
Let's get some rest. It's a long day.
I'm afraid her dementia is confirmed. However, on the brighter side, Madam Wensi is very much lucid most of the time. This is crucial, as patients with dementia often have challenges in more complex tasks, such as shopping, housework, or cooking, so she may need a level of assistance in these areas. It is also important for someone to keep a close eye on her. When you have decided who will be her main caregiver, whether it be yourselves or hiring a helper, they will help to carry out some basic caregiver training to make sure that when your mother goes back home, she'll be safe.